So thanks everybody for being here. My name is Kelly Greger with Missouri Institute of Mental Health, and this is the first in our parent series we're trying out here. So normally what we do is we do professional training for mental health professionals, behavioral health professionals, and we thought it would be a nice idea to do some things that are just more for the community. And so that's why we come up with this little program tonight. And this is Katie Ellison here, the other person you're seeing there. Katie, you want to say hi?
Hello, everyone. Thanks for joining us this evening.
So Katie works for MIMH as well, and she's going to be answering some questions for us. She's the one who's come up with this talk tonight. What parents need to know about youth suicide risk, but we're afraid to ask. Let me tell you a little bit about Katie. So Katie is a research project director here at the Institute with the Safer Homes Collaborative, and Katie and I work together on that project, as well as she works on other projects as well within the Institute, a lot of them on suicide prevention and so forth. Her research focuses on lethal means reduction strategies, such as reducing easy access to firearms in the home and as a means of preventing firearm suicide. So Katie also has a background in K through 12 public education, where she helped out with. Were you technically a social worker, or what would you?
My title was student assistance coordinator.
Student assistance coordinator. Okay.
Mm-hmm.
So she helped out in that, and then also has some background in. I was going to say the prison system, but that's not a good way to put it. But the
corrections, youth and adult corrections.
Yeah, corrections. And so with all that combined experience, she's brought that here to MIMH and is now doing suicide prevention work. And so actually today, Katie and I just did a professional training called Suicide Lifeguard, which is a program that she put together for us on suicide prevention just earlier in the day today. So hopefully we're both not, well, I'm not that tired. Hopefully you're not that tired because you spoke a lot more than I did at that time. So.
I'm good.
Well, we want to thank you all for being here at this kind of inaugural part of the parent series. And what we're going to do is I've got a series of questions I'm going to ask Katie. She's going to answer them, and then we'll get to your questions. So if you want to, at any time, you can put your questions into the Q&A. If you look at the bottom of your screen, you've got three things down there. You got the chat, you got the Q&A, and you got raise your hand. Well, if you want to put your question in the Q&A, I'll ask it for you at the end of our little interview here. And also you can also put things in chat as well if you want to, but we'll get things started off. I've got a series of questions that Katie's going to answer for us, and hopefully they'll cover a lot of the bases for you. If not, feel free to ask your questions. So or actually, before we do that, Katie, did you want to say anything else about yourself that I didn't cover on that?
Other than, my professional background and experience in that realm. So personally, I was a young person. I was first diagnosed with depression when I was 17 during my junior year of high school. I struggled with it, denial of it through college. And then it came to a crashing point after I graduated from college and I attempted suicide. I was able to get help, but it took a lot of years of recovery and acceptance that depression and anxiety were something that was just part of my genetic makeup, that it wasn't my fault, it wasn't something that I caused. And then I'm also a mom to a child. She has given me permission to share our journey together, part of her journey. I'm a mom to a child who's been hospitalized twice with suicidal ideation. She's never actually attempted, but so I've been on that side of the coin as well. And then when I worked for the school district in K-12 public education, in our community of about 40,000 people, we lost 15 current and former students to suicide in a 6-year time span. And so journeying with students and teachers who were losing classmates to suicide in this small, close connected community was impactful on me, and having to learn on the job of how do we approach this? How do we prevent this from continuing? So a little bit more on the personal side of my experience. So.
Okay, well, thanks for sharing it. We really appreciate it.
Absolutely.
Very much so. Let me ask you, what are some common signs or symptoms of suicide that parents should be watching for in their children?
So the thing to keep in mind with young people is that it is a change from what would be expected or the norm. So common signs would be a change in their mood, and more than typical for an adolescent or a young adult. Adolescents tend to have daily swings in mood, or even parts of the day, their mood swings. But this would be significant and sustained mood swings. Withdrawing for 2 weeks or more, pulling away from activities that they found enjoyable, dropping out of their friendships, not showing up to things. Just they seem to isolate, especially in their rooms, and more so than the typical teenager isolates. They're closed off sometimes. It may appear as emotional, like crying. Sometimes it comes out as irritable, and more irritable than typical teenage experience or young person would experience. It can appear, a risk factor can be like anxiety, where they're more agitated, excessive worrying, sleeping too much, not sleeping at all, eating too much, not eating at all, talking about suicide, writing about suicide, drawing about suicide. It's normal for kids to be curious about, I mean young people. It's normal for them to have questions and be curious about death, but are they writing about it in a way that doesn't feel developmentally natural or appropriate? Are they writing and drawing about their own death, about their own suicide, or depicting pictures of suicide and death? Those are just some of the many warning signs that you might recognize in a young person who might be at risk.
So it seems like kind of you would know your normal behavior, and so whenever they veer one way or another in that behavior, then that would be something to be concerned about, I guess. So why do you think people, young people, want to kill themselves? I mean, what could be so? I think about my own children. What could be so bad in their lives that this would be the thought pattern? Because as parents, you always try to do what's best and take care of your kids, but
absolutely,
there is no divide there. It's not like there's a socioeconomic divide or anything like that would you say that's the line where kids whose parents make a certain amount of money aren't going to do this, and kids who don't are. But that's not the case. So why do they go to this kind of firsthand rather than later, or think about it at all?
Right. So it's not complex. Well, yeah, it's a complex question to answer, meaning that it has many tendrils to it, I guess, so to speak. So, it's never just one reason why kids think about suicide or attempt suicide or go on to die by suicide. It's usually a combination of factors. One common, although not always, but one very common underlying factor of why kids attempt or think about or die by suicide is an underlying mental health condition, depression being one. And depression can be brought on by environmental factors. It can be just brain chemistry, that your body doesn't make those good hormones, enough of those good hormones in the brain. It can be situational in reaction to a trauma that they experienced, or a loss that they experienced, and they get stuck. So that is sometimes, although not always, but frequently enough, that might be like the base issue. And then kids experience the same type of life challenges and crises that many adults experience. You know, they may be growing up in a community or a home where they're experiencing financial insecurity. We all just went through, or maybe we're still going through, this global pandemic where we were isolated from our support systems. You know, we've gotten pulled out and away from the activities that we used to enjoy doing that maybe created some buffers, some protective factors. We're disconnected from some relationships. And so that compounds it. And then the stressors of, you know, when we think about it as adults, we have stressors in our performance for work and our significant relationships and managing households and getting everyone to and fro. Well, kids have pressures like that too on them. They have the challenge of school and or sports or activities and performing, living up to expectations. Kids can use and abuse substances just like adults can. And so we start layering on all of these life stressors that even adults experience. And then as they start to pile on, our coping mechanisms, our response mechanisms can be diminished because of that underlying mental health condition, or because of the using of drugs or alcohol, or feeling as though we can't turn to someone, or maybe we don't have those sources of support that we can turn to and talk to about this. So yes, kids have great lives. We try to give young people our kids the best life that they possibly can. But sometimes our coping strategies are just taxed, and it can be impulsive, it can be reactionary to that straw that breaks the camel's back. A great metaphor I heard once for suicide is, if this cup represents life events that I were to experience, and let's say I have, well, like for myself as a young person, I had a mental health condition and it fills up with water up to here. And let's say I've got the pressures of trying to keep up with school, but my mental health condition, you know, just keeps pulling me down, and my parents are getting after me about my school. And then I have my own internal getting down on myself for not doing well. And then, you know, I isolate or I withdraw because I pull out of a sport that I once enjoyed, or an activity that I once enjoyed. So I lose those connections to relationships or that coach who might have been a good support person for me. And then maybe I have a significant relationship that I lose. You know, maybe my best friend and I have a falling out. And so I don't have that friend in my life. And then I bomb a test at school, and I'm way simplifying this, Kelly, but let's say I have a day where I get a bad test. I have an interaction with a teacher that I interpret as being really, really negative. And then I go home and let's say I turn to my mom and dad's liquor cabinet, or I have marijuana in my house and I smoke a joint or whatever. And then my parents come home and they find me and they start on me. And in my home, I have easy access to a lethal means, whether it's medications or over-the-counter medications, maybe it's a firearm or a belt or a rope. And just in my crisis, because I'm not thinking properly, I'm not thinking clearly, my brain is already struggling because of that underlying mental health condition. And my mental processes, the voice in my head starts saying, boy, you're not worth it. You've got nothing to live for. No one cares about you. Your parents would be better off dead. You've screwed up. You've ruined your life. If they have easy access to lethal means, in a flick of a switch, in a moment, they can turn to those. And that's when tragedy can happen. So there's no formula, Kelly. There's no easy answer as to why kids think about suicide. or why they end up killing themselves. Another factor that we know plays a role is social media and the pressures of perfection. You see people out, you see their peers out having fun with others, and they're not invited, they're not included, or others have things that you don't have. And you just feel it can run your mindset down. It can run, it affects children differently than it affects adults. Because their brains aren't fully formed or functioning, as well as that prefrontal cortex, the problem solving and the thinking through part of the brain doesn't fully form until age 24. So they don't necessarily physiologically have the ability to fully see through from, if I engage in action A, it can end in action B. They don't necessarily see that all the way through. And so the long and short is the answer is complex. However, it isn't just, the answer is not because kids are selfish or they're just doing to get attention. They experience real challenges just like we do as adults. And it's that coping ability in that acute moment of time, and are the circumstances right? It's kind of like the coming together of a perfect storm, Kelly. In order for there to be a hurricane, you have to have the right combination of weather events going on to formulate the winds and the circulation. And absence of one of those pieces of creating a hurricane, you're not going to have a hurricane.
Right. Yeah.
A shift in weather is not going to create it. So,
and we kind of touched upon it a little bit, but how common is this? So statistically, what is the statistics on attempts or completions in adolescence?
So, well, for adults, I don't have the immediate numbers in my head for adolescents, and I should. I apologize for that. But in adults, so in the last 12 months, roughly 12 million adults had serious thoughts of suicide. So we know that our adolescent population is not as numerous as the adult population, but it's probably, in terms of percentage-wise, it's probably comparable. So 1 in 4 adults across the lifespan will experience, a major mental health condition. So 1 in 4 adolescents can experience that underlying mental health condition. And they all experience those life crises and challenges. So getting back to your answer or your question, 12 million adults a year in the last 12 months had serious thoughts about suicide. 1.4 million had serious thoughts and made a plan. 1.3 million had serious thoughts, made a plan, and went on to attempt suicide. Those who died by suicide, I don't want to say only, but compared to the 12 million that had serious thoughts about or made a plan for suicide, 47,000 adults and children died by suicide last year. So statistically speaking, if we do that math, it's somewhere like off the top of my head, I can't remember if it's like 0.4%, 0.04%, Kelly. Someone smarter than me can do the math, but it's less than 1%
Sure.
who have serious thoughts about suicide actually go on to die by suicide. So that of that 47,000 who die by suicide, in a year between the ages of 10 and 24, I want to say the number of, this is a horrible word to use, but the number of completed suicides in those age ranges are less than a couple thousand. So it's rare. Even though we hear about it all too frequently, it's quite rare for a young person to actually die by suicide. It's far more likely that they have thoughts about suicide, and it's far more likely that they attempt suicide. Fortunately, it's far more rare for them to die in a suicide attempt.
Oh, that's fantastic. We hear about it so much that I think you can catastrophize it and think that it's more than that. So that's good. This is a weird question, but because of COVID right now, especially in the environment, with the weather environment we're in today, kids were at home from school, but school is a huge part of a child's life. And so, if they have been identified as suicidal, what happens at school now with the variants of COVID in this, with being at home a lot and so forth, is probably different than normal, but normally what would it be if they're identified like that?
Depending on the state and depending on the Department of Education here in Missouri and many other states, educators are required to complete suicide prevention education and training. So a teacher or a school counselor may recognize or find a note or be told by a peer that, I'll use my name, that Katie is at risk for suicide. And typically what we want to happen, best practice, ideally, is we would want the school counselor or school social worker assigned to that student to be notified by either the classroom teacher or whoever recognized that that student is at risk, that Katie's at risk, that they be notified as soon as possible. If they find out on a Thursday morning, they're going to tell that school counselor Thursday morning. The school counselor should then call Katie into the office, have a conversation with Katie. That school counselor has available to them several different type of suicide assessment tools or screening tools that they can either walk through with Katie in conversation format or have Katie fill out and self-report. But mostly it's going to be done in terms of a conversation. They may say, you know what, Katie, Mrs. Johnson emailed me and said that she found, or she got your paper where you wrote about being so sad and you're not sure if you want to go on living. And she was very concerned for me. So I called you in because I wanted to explore that with you. How are things going? And through that conversation, that school counselor is asking follow-up questions and trying to decipher how Katie is doing. Ideally, that school counselor is going to follow up with, you know what, Katie, with everything you've told me, it would not at all be uncommon for a young person like you to have periodic thoughts about suicide, periodic thoughts about killing themselves. I'm wondering if you've ever had those thoughts. And hopefully Katie feels comfortable with her school counselor and she would be willing to open up because of the positive relationship that they have. And if Katie tells that school counselor yes, that school counselor is going to say, you know what, Katie, we need to get your mom or an adult that you trust, or your dad or your grandparent, whomever the adult in your life is, we need to get them involved because this is beyond the scope of what we can treat here in the school system. We need to get you some additional help. We want to get you some additional help. We'd like to refer you for some counseling. We would like to have you evaluated or assessed with a crisis counselor to see if you're okay to go home today, but we don't want you to go home alone. The school counselor would then reach out to the adult in that student's life. Ideally, it's that student's parent. And in an ideal world, they're going to have a conversation with the parent, letting them know that they had this conversation with Katie and that their recommendation is that Katie follows up with a crisis counselor to have a suicide assessment. Typically, those crisis counselors can be found at a community mental health agency where they can get in the same day and be assessed for suicide that same day. Sometimes they're referred to an emergency department, and an on-call crisis counselor comes to the emergency department and does the suicide assessment with her there. And then from there, depending on Katie's answers, input from parents, maybe input sometimes, but not always, input from the school, that crisis counselor completes a more robust suicide assessment that asks many more in-depth, detailed questions about Katie's thoughts about suicide. And from there, they will have a recommendation. The recommendation could be that Katie can go home with her mom and dad tonight, but they are going to refer her to the counselor in the community counseling agency. Or they're going to work with the school to have counseling arranged for in the school building. That can happen as well. Or maybe Katie's mom says, well, we have the resources and we have the contacts, or Katie is already seeing a counselor, we'll follow back up with her counselor. Sometimes, depending on what Katie says, it may be that Katie needs, for her own safety, she needs to be admitted to the inpatient psychiatric unit, the pediatric inpatient psychiatric unit, where they will monitor her. They will help stabilize her. Sometimes that's through prescribing, starting her out on a medication. They will develop start to develop a discharge plan, help to make those appointments and arrangements. They will build a safety plan for what Katie and her parents can do to keep her safe when she returns home, so that they know that she has contacts and resources to reach out via phone to our clinic, to the National Suicide Prevention Lifeline if needed, that they know that they have the emergency contact number to the counselor that's available. And so those are all of the ideal outcomes. And actually, not only are they ideal, they are what parents should expect from their experience. That whether Katie leaves from the emergency department or the crisis counselor's office at the community counseling agency, or if she goes to inpatient to be stabilized for a few days, that their parents should expect that Katie is released with a plan to help keep her safe in the home. The parents know what that plan is, and that she is referred on. They know when their next appointment is going to be, or they have those contact phone numbers to make those arrangements back in their community.
Now, we've been talking about suicide and suicide prevention for almost a half an hour now, but I think most people, that's not a common topic. And especially if you're talking with your kids about it. So what, if as a parent, what can you say and what should you say? Because I'm sure that a lot of people think, well, if I bring it up, it's going to plant this idea about it as opposed to be helpful. So how do you approach that?
So my answer to that is you cannot plant a seed where there's not already tended and fertile ground. So kids know about suicide first and foremost. Even young children know about suicide. They may not fully understand it, but because they have access to social media, to TikTok, to YouTube, kids have heard about suicide. So as parents, don't be afraid to talk to your kids about suicide. Don't be afraid to, I just had this conversation with my son just tonight as I was eating my charcuterie board of salami and cheese, because I was telling him we were going to be doing this tonight. And I said, he's 10, almost 11. And I said, well, Sam, have you ever thought about suicide? And he's like, well, no, I've never thought about like doing it to myself, but I think about suicide because that's your job and you help kids. And I'm like, okay, so how do you feel about suicide? And so we took the conversation from there. I let him be curious. I let him ask me honest questions. And without fear, I try to answer those questions. that he has. Even when my daughter was younger, and I was working in suicide prevention, I would have a poster in my office about Acknowledge, Care, Tell was the acronym, ACT, Acknowledge, Care, Tell. And even as a young girl, she recognized that, well, she knew one of her friends, I can't remember if she was like in 4th or 5th grade, one of her young classmates said something to her about wishing she were dead. And Megan took it seriously. And because we talk about suicide, because I had that poster in my office, she referenced the poster in my office of Acknowledge, Care, Tell, that I encouraged her to come and talk to me if she ever had thoughts or feelings about suicide, or any of her friends were having thoughts, feelings about suicide. She came and told me. And so she passed it on to an adult that she trusted, and I made the call to that young lady's mother. You know, in terms of asking kids, are you having thoughts about suicide? Asking that question just like that. Honey, has the thought of suicide ever crossed your mind? Asking the question before there's a crisis, before it's a heated moment, before there's this eruption of emotions, when you're just having windshield time. I have windshield time with my kids. You know, you're not looking eye to eye, the pressure's off, but you know, when the door opens, when the opportunity opens, ask, have you ever thought thoughts about suicide? Because I remember when I was a young person, I sometimes had thoughts about suicide, or I knew kids who died by suicide. And I'm just wondering if you've ever had those thoughts, and just engage in that honest, caring, compassionate conversation with them. It takes courage. But if you're willing to go there, chances are your kids are willing to reciprocate and have that conversation. Then, if those feelings ever occur for themselves, they're going to feel comfortable coming back to you and having a conversation with you.
And that's very interesting, because also, even if you're not talking about their feelings towards this, there may be a situation that someone in their grade or at their school or something completes suicide, and then that conversation will come up as well. How do you handle that? So it's obvious something's happened, and everyone will find out about it, obviously, but you know, what do you do whenever that does happen? How do you talk about it?
It would go back to being honest and starting off with asking them questions. Did you know that student? How did you know them? Were you in were they elicit if they were in any classes with you? And then ask them, how do you feel? How does this impact you? And for some kids, it will be, doesn't impact me at all. I didn't know them. I saw them in the hall a couple of times, but I really didn't know them, and it didn't impact me at all. Mm-hmm. Other kids, maybe they didn't know them, but they themselves have been struggling. And maybe they're not having thoughts of suicide, but they're emotionally struggling. And it may evolve into a conversation where they're willing to talk to you about their challenges. Ask, and then follow up and ask, have you ever had thoughts about killing yourself? I think too often we try to soften it and we ask our kids, have you ever thought about harming yourself? And I would encourage parents to be brave enough to ask the question specifically, have you ever thought about killing yourself? Because there's a difference in a young person's brain between harming and killing. So we want to be specific and we want to be direct. And if she or he tells you, yeah, I've had those thoughts, it's important we don't react from a place of fear. And sometimes my fear comes out as anger with my kids, like, what? To be calm and to be confident yourself and say, wow, tell me a little bit more about that. What did you think at the time? What kept you from engaging in suicide? And then tell them, I thank them. No matter what they're willing to tell you, thank them for being willing to have that conversation, and then encourage them. You know, if you ever want to have this conversation again, or you ever have questions, or if you know anyone who's having thoughts about suicide, I want to just open that door and invite you to come back and talk to me.
This idea of so if you think about like famous people, I'm trying to think of but Robin Williams comes to mind, who died by suicide. And you think about when something like that happens, your mind kind of wanders. You think this is going to be triggering, and you're going to have all these other issues, especially if there's somebody who they identified with as this famous person and so forth.
I lost your video. Maybe that was me. Oh, I just lost Kelly. Are you still with us, Kelly? All right. So we were kind of afraid that with the weather that Kelly might get knocked off. And since I don't hear him, and I don't know if you guys can hear me, where Kelly was kind of going with that question, I think, was when a young person or a celebrity dies by suicide, and kids identify with that young person, or they followed that young person in media. Oh, thanks, Jessica. I appreciate that. You know, can it be triggering for a young person to think about suicide? Of course, it's going to of course, kids are going to think about suicide because they understand what suicide is. It isn't necessarily going to plant a seed or an idea that that young person should kill themselves, or that they should end their life if the ground isn't already fertile for that, if there aren't already some of those precipitating risk factors for suicide. You know, if they have good social supports, if they have good coping mechanisms, if they have good resiliency, if they have adults in their life that they can turn to if they're concerned or if they're having trouble, whether it's a teacher or a coach or a pastor or even their parents, sometimes it is not necessarily going to put the idea in their mind, oh, I should just go kill myself. Now, if it is a young person who highly identifies with that celebrity, they ruminate in it, they already have some of those risk factors for suicide, they've already been thinking about suicide, it can precipitate their plan. It can influence their decision-making about the method by which they would die by suicide. Or it might cause them to think about when or where or how. For example, back in the early 2000s in Palo Alto, California, they have like a metro train system in that community. And several young people died by suicide. I hate to be grotesque, but they died by suicide on the train tracks. And that became a glamorized way for young people to end their lives. And over years, many more young people went on to die by suicide through that same manner. And unfortunately, it had to do with the press coverage, the notoriety of it, the easy access to the train tracks, and that there was an absence or a lack of communication or not enough emphasis was put on that there was help available, that having thoughts of suicide is normal, getting help and asking for help is normal. And when you get help, when you're able to get help, things can get better and you may never be suicidal again. And so how we as adults in our communities, how we handle these conversations, how the media writes about it or covers a suicide death can all influence or not influence a young person's potential suicidal ideation.
Sorry, Katie, my system crashed, but I'm back now. So
that's okay. I realized, and they told me they could hear, so I just kept answering.
Yeah. So, and I'm sorry I missed out on the last few minutes here, but I think you finished up. So I don't know if you went into the part here now where can folks get help at as far as that's concerned?
Sure. So, okay, lots of places parents can go for help for their young people. Especially, and my comments are specifically focused on when that young person is under the age of 18. So up to the age of 17. So once they turn 18, there's an asterisk behind it. So under the age of 18, or if they're a high school senior age 18, they can start off by going to their child's school counselor if they feel comfortable. And they can ask their school counselor if their school or their school districts have any internal resources that can support students. Like here in Missouri, there are, in St. Louis region, many schools have partnerships with behavioral health agencies where they have counselors come in and work one-on-one with students, where they can do the counseling session right there at the school building. Sometimes they have referral mechanisms to an outside community mental health agency for counseling services. School counselors frequently will have a list of providers that are available in the community that they can recommend parents check out for counseling support. Another place to go for support or help is to start off with the pediatrician. Make a doctor's appointment to either to do a physical, to rule in or rule out that there's anything biological or physical going on that may be contributing to the risk factors. Because like I mentioned before, sometimes there's underlying mental health conditions that may or may not be identified that may come on based on a situation or a circumstance, trauma experience, or maybe it's just biochemical, not having the good hormones in the brain. That's my experience. My my body doesn't make enough of the good hormones. So having a conversation with the pediatrician for how to get started or where to start is a good place. It's also not stigmatizing to start with the pediatrician, because kids go to the pediatrician all the time for all kinds of reasons. So it's not as threatening. Another place a parent could turn to for some support and help, the National Suicide Prevention Lifeline. And if you have a pen or pencil available, I'll also type it into the chat box here in a moment. But that phone number is 1-800-273-8255. The National Suicide Prevention Lifeline is answered 24 hours a day, 7 days a week, 365 days a year. It's free and it's confidential, and that the phone calls are answered by trained professionals. And you can ask questions. You can tell them, what your concerns are, and they have access to the list of resources, the behavioral health providers that are available in your community. If you live in a rural area, they know who are the regional providers, or if you're looking for a provider in another state, they can also help you find out who else you can reach out to in another location. There's a question in the chat box from McKinley are there support groups for parents that have children who are dealing with suicidal thoughts and mental health struggles? Yes, there is. The National Alliance for Mental Illness, NAMI, is what it's called. And it is a nonprofit program put together to support parents, to support family members, to support spouses of family members who are dealing with mental health struggles. They offer in-person support groups, online support groups. They have a Facebook presence. They do conferences. They would also know what other resources are available in your region or in your state if they weren't a great fit for you, or if they didn't have a way to manage it. You're so welcome, McKinley. Another option, if NAMI doesn't have an answer for you, is go to the school counselor and ask them if they are aware of any support groups, because the school counselor seems to be that funnel of resource mechanism within your community. And chances are, if the school counselor doesn't know, they know someone who will know the answer to that question. Also, Facebook is much, it's here nor there, but there's a lot of parent support groups for specific conditions. If you have a child who has neurodiversion or is neurodivergent, if your child struggles with ADHD, if your child struggles with bipolar disorder or schizophrenia, those always kind of come with a grain of salt, because you never know necessarily who's moderating or facilitating those Facebook groups. But many people have mentioned that they have found a lot of support or good information, or it has rabbit holed them onto additional resources.
As far as kids go, also at their school, shouldn't there be some resources now available at the school level, you think? Or would that be a good place to go if you're searching?
It very well could be. Now, it just depends. Sometimes those community mental health agencies will bring in counselors to facilitate groups there at the school, or they'll do parent education type events, or they'll provide support to the students in a group type setting. You really just have to ask. Usually it's not facilitated by the school or the school counselor themselves, but they could bring, and sometimes, I don't want to say often, but sometimes they do bring in those outside resources to work at the school.
Well, I think at this point, let's transition to questions. So we already took a question from the audience. So let's go ahead, and if anybody else has questions, you can just type it into chat, and we'll get an answer for your question. While you're thinking about that. So we're in Missouri and so forth, and you did mention the 988 number that's coming to Missouri, right? Earlier, or that was earlier today?
That was earlier today. Okay, so the 988. You want to talk about? Yeah, I do, because it's super exciting. To the best of my ability, I'll talk about it. So the National Suicide Prevention Lifeline that I mentioned earlier, that has been, answered. It's answered regionally or by state, depending on where you are. So it's localized, but there hasn't been a lot of funding behind it. And as a nation, as the federal government has come to understand and recognize that, hey, we need more supports, more coordinated support, Congress worked to, just like we have a 911 for physical health emergencies, crime emergencies, those types of things, we need a 3-digit code for those mental health and substance use challenges that we have. So 2 years ago, maybe it's been 3 years ago now, they passed the legislation that said, yes, the Federal Communications, FCC or whatever that stands for, that they could establish 988. So they have been working with the infrastructure to transition beginning in July of this year, that all calls routed to the National Suicide Prevention Lifeline or 988, it'll all roll to that local or that regional answering center. So I live in the St. Louis region. So here, those phone calls are answered at Provident Behavioral Health and Behavioral Health Response, BHR. So it's recognized by my geolocation. It's recognized by my area code on my phone number. And if I were to call the National Suicide Prevention Lifeline, it would roll to one of those two agencies. If I were physically in another state calling, it would roll to wherever I was. It would roll to that geolocation's answering center. They could also roll me to, if I'm calling about someone in Florida, they could roll me to a call center in Florida so that I could talk to someone down there and get, if I needed to, get in touch with local authorities down there to get help and support for that person who was in suicide crisis. So starting in July, you can officially start using the 3-digit code 988 to reach out to the National Suicide Prevention Lifeline. I have been told that some cell phone service providers are already rolling calls to 988 to the Lifeline. However, it may be spotty. It's not all cell phone carriers. Also, the funding for it doesn't officially start until July 1. So we have been asked here in Missouri by the Department of Mental Health to encourage people to still call that 800 number until July 1. And I'm going to put that number in chat before I forget.
Okay, yeah, so that's exciting news, and it makes it much easier for people to remember a 3-digit number than it does, a 10-digit number. So definitely.
Yeah, it is. But there's a trick. There's another trick that you can do. So if you have a smartphone, she won't do it now because I have her on silent. But if you tell Siri, or if you have an Android phone, whatever operating system you have, but if you tell Siri, I want to kill myself, she will respond, it sounds like you need some help. Would you like me to call the National Suicide Prevention Lifeline? And then that number, she will automatically dial the Lifeline. So that's another shortcut. If you don't have the phone number saved into your phone, or you can't remember the 10-digit number, until the 988 rolls out, that's another life-saving shortcut.
Oh, fantastic. Well, I don't see any other questions in the chat at the moment. We're almost up with our time, and I want to thank you for rolling with me since we had some technical problems there. Appreciate it. But thank you very much, Katie, for being with us here tonight and discussing these things and giving us some information that we can use. And I want to thank everybody who is attending as well for being here and getting a little more information about what's going on to help yourself and to help your kids. So
yeah,
I just want to finish
up. I just want to finish up, Kelly, by giving hope, planting a seed of hope for parents. If this is you walking through this struggle with your young person, or if someday you find yourself going through this with someone, that suicide is not a constant. It's not a terminal. Having thoughts about suicide is not constant. It can be recurrent. In some mental health conditions, it can be chronic, but even those with pervasive suicidal thoughts and urges can learn skills and be taught internal resources and external resources to help them manage those thoughts and feelings. There are medications, whether you are pro-medication or anti-medication, it doesn't matter to me. There are homeopathic remedies. There's Western and Eastern medicine approaches, learning mindfulness. There's all kinds of things that can be done to help manage, to help overcome. Hopefully I'm a walking, talking, living example of someone who attempted suicide, thankfully survived her suicide. And even though I continue to live with depression and anxiety, I like to think of myself as a fully functioning adult. I have 2 master's degrees. I have a husband. I have 2 kids. We own our home. I'm living my best life, lots of joy and happiness. And so if you're in it or you're going through it, there is hope. It can get better. There are all kinds of resources out there. You just have to find the one that best works for you.